morning, everyone. Hope everyone is having a good day. Welcome to the second episode of our series on the Chronicles of Being a CRA. yeah, I hope everybody has had a good long weekend, and let's get into it. So, this episode is about the day in the life of a CRA, and I'm just gonna give you what is the myths that people get up to or people say we do, and what are the real truths of what we actually do on a daily basis. So yeah, people would say, you guys travel for fun, you guys travel and chill at hotels, great hotels, enjoy airport food and all that, and yeah, have checklists that you just go and check outside. So that is not what we do on a daily basis. So I'm gonna give you a brief background of what we do on a daily basis. I'm gonna give you a breakdown of what we do when we're traveling and when we're not traveling. So that is gonna be the basis of the story for today. And yeah, let's stay engaged. Let's have a conversation about it, and let's make it fun for everyone. So let's say that I'm going to site. What happens when I'm going to site? Whether I'm traveling the night before or I'm traveling in the morning. But I'm just gonna start with traveling in the morning. Usually, we try and catch the first flight out of the town. So let's say that I'm traveling to another city that needs a flight. So I need to wake up around 3:30 or 4. Do what I need to do, pack my laptops, pack my bags that I'm gonna be with my clothes and everything, and then pack everything that I'd need for the specific trip, right? Get to the airport, fly out to the city. Usually for me, it's either Cape Town, Durban, Bloem, monitored in Limpopo yet, but Durban, Bloem, Cape Town, PE, all the major cities, all the big cities, right? So fly out there. When I get there, go either collect a car or use an Uber. But I don't usually use an Uber, so I would collect a car at one of the car rental companies, collect a car there, and then get to site. When I get to site, what I usually do when I arrive at site is make sure that I sign in into the site, and then after I sign in, I ask for the study coordinator to have a conversation on or to debrief on our previous visit, what has happened during the time that I was not at site, and what we're gonna do for this specific visit that we're having, right? So we're gonna have a conversation about that, any AEs, any action items that need to be closed, what I'm gonna be looking at for this visit, which patients I'm gonna be looking at, and what facilities will I be visiting at this specific visit, right? So that is important because you want the site to plan properly for you. You would have written this also in your confirmation letter that you would send to site to say that I'm coming to your site next week. So please prepare this and this and this and this for my visit. And you having a conversation with the study coordinators just to reiterate what you already told them in the confirmation letter, and to make sure that we are aligned in terms of the visit and what I would need for the visit, right? So that's what I'm gonna do. I get the files that I need to deal with. I deal with those. I visit the facilities that I need to visit, and that is how the visit goes. I look at firstly. I look at my informed consents. I look at SDVSDR. I look at the pharmacy file. I look at the lab file if the shipments were done in time. If it's a time-bound shipment. Study. If it's not a time-bound shipment study, then were the shipment done correctly? How were they done? Were the right samples collected? And all those. So that is one of them. Pharmacy, we're looking at drug accountability, meaning that we're looking at where all the patients getting the right drug from the pharmacy, and are the conditions of the pharmacy still adequate for the study or not, and what happens in terms of if there's an excursion and all that, how do the site deal with such situations and all that, right? So that is in terms of accountability of drug. And then SDV, SDR, we're looking at data integrity, we're looking at patient safety, and we're looking at compliance. With compliance, we mean compliance to the regulatory authorities of South Africa, its guidelines, compliance to ethics, and compliance to whether the protocol, investigator brochure, or all the documents that are there, is the site complying with the documents that we have outlined, and how the study should be run at site, right? Patient safety, we're looking at any safety related issues in terms of patients. We're looking at if there's any ethical misconduct from the site in terms of the safety of the patient. We're looking at all the safety related issues in terms of the patients. Are the patients being taken care of as they should be? Are they getting the medication as they should? Are they getting the right medication, which have been stored in the right conditions and all that? So that is part of your patient safety. And with data integrity, we're looking at if the data that is in the patient files is the one that has been transcribed into the systems that we have. If the people that were collecting the data are delegated to be collecting the data that they've been collecting, if the people that were working on the study, are they qualified in terms of school or in terms of education, in terms of experience, and also in terms of the protocol, have they been trained for the protocol and all that, right? And also if there's any protocol deviations or any deviation from either GCP, good clinical practice, or the protocol, we need to retrain or re-educate the site on how they should make sure that they do follow the outlined guidelines, right? So that is in terms of when I'm at site. When I'm not at site, we're not chilling at the hotel and relaxing and chilling by the poolside and relaxing. No, there's still work that goes on in the background, like writing your report for your visit, making sure that you close all the action items remotely that can be closed remotely, making sure that the administrative work of helping the site is being done, your trackers, making sure that every document that needs to be collected is collected and it's filed in the relevant filing systems. And all those things are done when you're not working, when you're not at site, and you're either at the hotel or at home or at the office where you're working, right? So that is when I'm traveling. When I'm not traveling, I'm doing all the admin work in terms of my studies, and I'm supporting remotely, supporting my sites remotely. So CRAs are known to be protocol experts, right? We try and make sure that we understand the protocol as much as possible, so that if the sites come with questions, we do have the answers. You might not have all the answers, and you don't even stress if you don't have all the answers. You have a large community of aspects that can help you in terms of the questions that you have in the company that you're working for. We have medical scientists that help us. We have data people that help us, data monitors that help us. We have our study managers that help us. We have other CRAs that help us. And we have our CTAs, your clinical trial assistants, that help us a lot. So all that is a team effort to make sure that the studies run adequately, and the data that we collect, the data has integrity. The site follows the protocol and compliance, and then patients are kept in a safe environment for that trial to run better. Why I do this? I do this because I feel that to bring a lot of change. You might not see it now, but in a generation's time, or in the next few years, the drug that you're working on now will be in the market, helping someone's life, saving someone's life. And I can make an example with the drugs that are already in the market now. I can make an example with Panado. It had went through clinical trials, and there was a team of CRAs that worked on Panado to make sure that it's safe, all the adverse events have been reported, so that you know as a patient that, okay, if I drink Panado, I might get dizzy, or if I drink this, I might get dizzy. So that is what drives me on a daily basis, to know that the work that I'm putting in now is going to save a life in the next few years. And the drug, approved, regulatory approved, and being on the shelves, gives you that joy to say that I've also worked on this drug to make sure that they bring it out for you guys to get. So that's the day in the life of a CRA. And if you have any questions, comments, and everything, just go into the comment section, comment, like, subscribe, and look out for the next episode. Dango.